Okay, this is part 2 for the abdomen. The next organ that we talk about in the abdominal cavity is your kidneys, or are your kidneys. Remember, these are a bean-shaped structure. We call them, they're posterior to the abdominal contents, and we call that, or define that location as retroperitoneal. Retroperitoneal. So behind the abdomen and behind the contents in the rest of the abdomen. The kidneys are protected by the posterior ribs, which we know we have the anterior and the posterior rib cage, and also protected by those muscles in the posterior thoracic cavity. We've talked about the costovertebral angle before when we were talking about the when we were in the respiratory system. I had you all do that thump with the kidney where you went in that angle where the 12th rib, so that bottom rib, forms that angle with the vertebral column. So if this is your vertebral column and the ribs kind of curve in like that, it's this angle right in between there and the ribs. So this is that's the costovertebral angle, and this is where on the left side, this is where the 12th rib forms that angle with the vertebral column, but the left kidney lies here at the 11th and the 12th ribs. So when you think of anatomical position, so if you're looking at me, then it would be on this side of my body. So the left kidney lies here at the 11th and the 12th ribs. Because of the liver, the right kidney rests 1 to 2 centimeters lower than the left kidney. So kind of similar to when we talked about the lungs. The right lung is a little bit longer than the left lung. So that's why when we talk about the 12th rib forming the angle on the right side, but on the left side it's kind of between the 11th and the 12th, just because it doesn't lie as low as that right kidney does. Sometimes you can palpate the right kidney just because of that extra protrusion, but typically they're not palpable. So that's where we do that thump on the back, where we hold our hand up against that area, and then we do that thump on the person's back to see if they have any pain. Page 539 again will show you good pictures of the kidneys. And this is the picture that's there. Okay, so we're done talking about the organs in the abdominal cavity. Next, I want to just kind of refresh you on quadrants. So before you go on to the next slide, I'd like you to pause this presentation and just see if you can label the 4 quadrants. Now remember, anatomical position. So think about how that patient is standing when you label these. Make sure you don't get the left and the right side mixed up. This happens quite often. So this is the right upper, this is the left upper, the right lower, and the left lower quadrant. So sometimes you will see them abbreviated as RUQ for the right upper, LUQ for the left upper, RLQ and LLQ for the right lower and the left lower quadrants. Please know that on page 540 there is a list of organs that are found in the different quadrants and the regions, which we're going to talk about next. So please look over those. I will tell you that I do expect you to be able to tell me what organs are considered in each quadrant. So make sure that you look over that list on page 540 and that you know which organs fall in each of these quadrants. And that's what I was just talking about. Okay, now pause this presentation one more time, and I'd like you to name the 9 regions of the abdominal cavity. So we have the 4 quadrants, and now you have the 9 regions. So again, pause for just a moment. Okay, so hopefully you remembered these from A and P. You have your, again, anatomical position. So the right hypochondriac would be on the right side, left hypochondriac on the left side. In between the two is the epigastric region. The umbilical region is in the middle. The left lumbar and right lumbar are on the lateral sides of the umbilical region. And then we have the hypogastric region, which is towards the pubis, so it's the lower midsection of the abdominal cavity. And then on each side you have right iliac and left iliac. Some people have learned them as inguinal regions versus iliac regions. Either one is acceptable for me. I tend to use the words iliac more often than inguinal, but that certainly would be a correct description of them as well. Things that I want you to consider when you are looking at aging adults. Now, we talk about aging adults quite often in health assessment because your next semester you're going to be doing a gerontology rotation. So you'll be going into a nursing home, which is where you will be doing health assessments on this particular age group. So we often bring that up more often than any of the other considerations that are in your textbook. But so for aging adult, when we're talking about the abdominal region, remember again that the appearance is altered, just kind of the same as what we see with most of the anatomical features of older adults. We have that appearance alteration. In females, we tend to get more fat, suprapubic. So think about the pubic area and right above the pubic area. So it's just to the top of the pubic area. So obviously it's right over what we consider our belly. We have more fat in that areas. Males, as generalization, have more fat deposits than they do when they're younger. So whereas muscle was more predominant in the younger male, now we're starting to see more fat deposits in the males as they get older. Of course, this certainly can be a result of becoming sedentary, so not as active, not able to be as active as they used to be. But it also can be just a natural aging difference. As you see in the next sentence, it says that the adipose, or the fat, tends to shift from the face and extremities. So where we have a nice round face and it's nice and full and you don't have a lot of wrinkles, that fat in your face and in your extremities actually shifts down to the abdomen and the hips area. Not just for women, but for men as well. So we get a little bit more wrinkled up here and things start falling down here and they fall all the way down to our tummy. So it's not because we're necessarily fat, but it's because we have our fat is falling down into our stomach and we can't help it. Okay, maybe not in so many words, but that is one of the things that can also cause it. Our abdominal muscles, the muscles in the abdomen relax. So they're not as tight, they're not as strong, they don't work as well. We're not working them as much as we did when we were younger. How do you like the way I'm saying we? Because I guess I consider myself kind of an aging adult, but I don't like that, so maybe I'll stop saying we. Aging adults have abdominal musculature that relaxes a little bit more. So again, inability to actually do more exercise can lead to this problem. When we talk about the GI system, or the gastrointestinal system, in aging adults, we've talked about this with the nose, mouth, and throat, that they don't produce as much saliva. So the salivation decreases. And we know that saliva is the first thing that helps to break down our food as soon as we put it in our mouth. So we don't have as good of a breakdown of food. And when we talk about saliva specifically, we know that saliva helps to break down those carbohydrates right away. So carbohydrates aren't metabolized quite as well. And we know that that can lead to extra calories, which can lead to some of that excess fat as well. Esophageal emptying is delayed, so when we swallow food and it goes into our esophagus down into our stomach, it's not emptying into the stomach as fast as it did. So it takes a little bit longer to get through that esophagus. Gastric acid secretion decreases, so again, we have the problem with the food going down through the esophagus into the stomach, and then when it gets into the stomach, we don't have the acid secretion that we used to when we were younger, so the food isn't breaking up and breaking down as fast. Older adults have a higher incidence of gallstones, and in lab this week I am going to have a gallstone or partial gallstone for you to look at and some pictures. In January I had to have emergency gallbladder surgery, had no knowledge that my gallbladder was bad at all, but it was actually starting to rot inside my abdomen, and I didn't even know I had an issue. Plus, they found a huge gallstone. So while I was delirious with pain and going into surgery, I said, "Can you please take pictures and save the gallstone for me so I can show my students?" So see, even in pain and illness, I still think about my students. So I'll have that in lab this week for you guys to look at and enjoy, I guess you could say. The liver size also decreases with aging adults. So between the ages of 20 to 70, your liver size decreases 25%. Most of the time the function remains normal, but for some people it doesn't. Now, we know that drugs often get metabolized through the liver. So think about Tylenol. Tylenol is one of those that when your body is metabolizing that and breaking that down, it's going through the liver. So if you think about function being decreased and size being decreased, and you think about the amount of medications that a lot of aging adults have to take, you can imagine how having that decreased liver size could affect the way that their body is able to metabolize those medications. So that we do see a lot of problems with that. Constipation also can be a consideration for aging adults. Now, it's typically not because of a physiological factor, so to say, but it can be a result of other factors. If you look at page 541 in your textbook, it really talks a lot about all of these things that can happen. I'm looking at my book now, so I'm sorry I'm not looking at the camera, but I just wanted to read a little bit. 26% of women and 16% of men in younger adults have constipation, but when you get into the aging adults, so greater than or equal to 84 years of age, those numbers go up to 34% for women and 28% for men. So and when we talk about constipation, what we really want to have as a defining characteristic is that we have less than 3 bowel movements per week. So most people have a bowel movement every day, but when we get older, everything slows down. So we know that the motility of our intestines slow down as well, and these people don't have as many bowel movements. So if you can consider only having a bowel movement 3 times a week compared to what you probably have now, you can imagine how uncomfortable those people can be. Also, sometimes people, it's not just the physiologic as I talked about, but people older adults don't tend to drink as much water as they do when they're younger. They're not as thirsty. Everything's slowed down, so even their thirst level has slowed down. And they don't get a lot of fiber in their diet or get enough. Now, we have a lot of fiber supplements now, so people don't, they have a lot of options that they can use to keep the level of fiber up. But the reality is that when these people aren't as hungry and as thirsty, then this is where they start to have some of those problems. And then the other thing is, again, we talked about medications, and a lot of people are on a lot of medications that can cause constipation. Older people have pain, so they're on pain meds, and pain meds can tend to cause that. So this does it for this presentation, and I hope you enjoy it, and I will see you guys soon.